Hello fellows, this is DoctorX Tekalegn, and how are you doing? And today we are gonna discuss about ultrasound and how to do an abdominal ultrasound examination. Ultrasound is literally means a sound above the human ear hearing threshold, 20,000 Hz. Normally the ultrasound uses 1 to 20 plus megahertz of sound. Okay, let's discuss about abdominal ultrasound. Before we are doing the abdominal ultrasound, there are prerequisites that should be fulfilled. First, the stomach should be empty at least 6 hours before we do the abdominal ultrasound. So, do not eat after 9 p.m. at night before the day of the examination, and do the exam at the morning. If the patient is constipated, please give laxatives day before the exam. Second, avoid barium exam or endoscopy before the ultrasound examination. Third, ask about any history of surgery. And fourth, make the patient lie on our right side, holding his or her head with two hands. Then adjust the ultrasound at our right side, and we can start the examination after applying the acoustic jelly over the epigastric area. There are 8 types of or kinds of doing an ultrasound scan, and they are left intercostal scan. The second is left subcostal margin scan. The third is longitudinal scan. The fourth is left longitudinal scan, and the fifth is right longitudinal scan. Sixth is the transverse scan. Seventh is oblique scan, and eighth is the right subcostal margin scan. And the ninth one is the right hypochondriac oblique scan, and the 10th one is the right intercostal scan. We are gonna see each of them in detail, and you have to wait for me to end. Let's discuss about left intercostal scan. The indicator should be rotated 45 degrees to the right direction and be positioned at the left lower ribs area. It's used to visualize the spleen and the left kidney. And the spleen appeared in the triangular shape with the uniform internal echo, and the image to the left side is missed due to the air in the lung. The hilum of the spleen is normally less than 5 mm. If dilated, it shows increased portal vein pressure. See the size of the spleen, margin, dilated hilum, and twisted hilum. When the horizontal measurement and longitudinal measurement exceeds 30 centimeters square, that showed splenomegaly. And the differentials would be blood dyscrasias, diffuse hepatic disease, portal hypertension, and metabolic diseases. If the splenomegaly, we have to scan the liver later. If we put the probe one intercostal space lower, then we can see the left kidney. Then see the kidney's location, the size, and the shape. Kidney and spleen are separated with hyperechoic line, but if the acidity occurs, they get separated further and return back together with no hyperechogenic line. If kidney pelvis becomes hypoechogenic at its center, hydronephrosis would be the diagnosis, and we can see the kidney stone too. Okay, let's see the left subcostal margin scan. First, we put the probe at the epigastric area, then we tilt the probe to the right side against the left subcostal margin, and this scan used to visualize the left hepatic lobe, and it should be appear semi-hypoechogenic and uniform area. Okay, now let's see the longitudinal scan. First, we place the probe at the center of the epigastric area. It used to visualize the left hepatic lobe, and we have to check the hepatic surface whether it's flat or not. Hepatic margin forms an acute angle normally, and to make the image clearer, make the patient inhale and hold his or her breath. In cirrhosis, the hepatic surface is irregular. The hepatic margin forms the obtuse angle, which is greater than 90 degrees. The echoes from the hepatic parenchyma are separated and high. Now we are gonna see the left longitudinal scan. First, we move the probe to the left of the midline in the epigastric area. Then observe the size of the body of the pancreas, dilatation of the pancreatic duct, the thickness of the gastric wall, perigastric lymph nodes enlargement. Now we are gonna see the right longitudinal scan. It used to visualize the pancreas and use the superior mesenteric vein and inferior vena cava to locate the pancreatic head. Then observe the pancreatic head size and echo level, calcification, tumor, pancreatic duct dilatation. Now let's see the transverse scan. First, position the indicator to the right of the patient in the epigastric area. It used to visualize the pancreas clearly. Press down and tilt the probe backwards. This is because the gas would be expelled from the stomach. Normally, the pancreatic duct size is less than or equal to 2 mm. If dilated, check for the tumor in the head of the pancreas. And this scan also used to locate the arteries and to see the swollen lymph nodes. If the lymph nodes around the celiac and common hepatic arteries are swollen, they would be visible above the pancreas. Okay, now let's see oblique scan. It used to visualize the tail of the pancreas. Place the probe over the pancreas elongation, then move it upward and to the right side. Check for the size, the tumor, echo level and the dilatation of the pancreatic duct. For the clearer image, make the patient to sit in upright position with the hand supporting the body on the bed from behind. Now let's see the right subcostal margin scan. It used to visualize the right hepatic lobe, gallbladder, bile duct and right kidney. Place the probe below the inner aspect of the right subcostal margin, then tilt it backward, then repeat the motion several times. For the clearer image, inhalation and holding breath is effective. Then check for the tumor in the liver parenchymas, and parenchymal echo level, dilatation of intrahepatic bile duct, diameter of hepatic vein and portal vein, border between liver and right kidney, which is called Morrison's pouch. The echogenic levels of the liver and the right kidney are almost the same, which is semi-hypoechoic, but in case of fatty liver, the liver becomes more hypoechoic than the right kidney, which is called hepatorenal contrast. In fatty liver we see deeper regions are hypoechoic, hepatic vessels are narrow and ambiguous, liver has increased echo level with hepatorenal contrast, and spleen or renal contrast is positive too. If we see a foreign body in the gallbladder, make the patient on his or her left lateral position. If the foreign body changes position, we confirm the diagnosis is a gallstone. Otherwise, it's a gallbladder polyp which defies gravity. For the clearer image, inhalation and holding breath is effective. If our patient is obese, use right intercostal scan between 6 and 7 ribs. In obese patients, gallbladder normally locates higher, and in lean patient, gallbladder locates lower. Tilt the probe backward till it's parallel to the abdomen. It used to see the hepatic dome and deeper areas of the right hepatic lobe. Now let's see the right hypochondriac oblique scan. First, we instruct the patient to do abdominal breathing. For clearer image, lateral decubitus position can help. It used to visualize the portal vein, superior bile duct, and inferior bile duct. If dilatation, check for the tumors. The portal vein is normally 50 mm in diameter. The superior bile duct is normally 8 mm and inferior bile duct is 9 mm in diameter. If the diameters exceed these values, dilatation is suspected. If the size of the bile duct is equal or greater than that of the portal vein's diameter, the bile duct is universally dilated, in the sign called shotgun sign. At last, we are gonna see the right intercostal scan. It used to visualize the right hepatic lobe gallbladder and the right hepatic duct. Slide the probe over the region from the 7th to 9th rib. Then observe the gallbladder wall and the lumen. It is best to evaluate the cervical part of the gallbladder. Then move the probe in fan pattern to the next intercostal space. It helps to evaluate the hepatorenal contrast, presence of fluid in the Morrison's pouch. We have to note some points when we do the abdominal ultrasound. First, the scans of each plane should be recorded in hard copy even if